Welcome back to Optimize Health, where we're making easy, healthy, and delicious meals. Today we're continuing on our information series covering interesting and key topics that relate to low carb dieting. And today we're going to do one that's pretty controversial, but new research is continuing to come out, and a lot of it's very promising for the potential benefits of low carb. So I'm just going to get right into it.
You should talk to your doctor, healthcare provider, or veterinarian to see if any of these recipes, suggestions, or contents of these videos are right for you. Nothing contained in these videos are intended to be taken as medical advice. Use at your own risk.
Important things to note that we're seeing research supporting the fact that higher LDL and higher cholesterol, that's often seen when people transition to a low carb diet, is associated with decreased risk of cancer, decreased risk of dementia or Alzheimer's, or some of these cognitive decline, and better cognitive function, particularly in older people, and best yet, decreased risk in all-cause mortality. So that's exciting news. So people often get concerned when they see on a low-carb diet, they're feeling better, they're losing weight, they have a lot of benefits that are tangible. But when they get their lab results, it's like, oh no, I have an elevated cholesterol, and oh no, maybe it's LDL, or maybe it's HDL and LDL. So I'm just going to get into that a little bit, that these higher levels of cholesterol may be beneficial, and they may not be detrimental like Western medicine historically for decades has been so worried about. So studies are showing that the association with cholesterol and cardiovascular disease is low on its own, and the only time that it's perceivably relevant is when you combine it with other cardiovascular disease risk factors. So these would be things that we already know: diabetes, high blood pressure, having elevated insulin and blood sugar, which again relate to diabetes, having elevated triglycerides, having low HDL, and having a small LDL ApoB lipoprotein particle size. So these are things that are often seen with a standard American diet. They're not typically seen with low carb diet, because low carb tends to lower our risk for most of these things, and dramatically so. So the blood sugar, the blood glucose, the insulin, and the triglycerides are all going to go down. These three elements are elevated in the context of high carb diets, particularly highly processed carbs. If you're seeing decreased LDL, a lot of times that's because you're not leading a healthy lifestyle as far as like exercise and activity. The ApoB protein size is very important to note, that the LDL apoprotein B particle size can either be small or large. We have to simplify it. When you're going to see the smaller size, that's because of oxidative damage that occurs to that LDL particle. The oxidative damage, no surprise, is going to occur with like a standard American diet, a Western diet. Again, all of these things that we just mentioned, with high blood sugar, high insulin, high triglycerides, chronic inflammation, and other sources of chronic stress, as well as food allergies, can kind of be another source of chronic stress and inflammation. Sometimes people don't think about that. So those are some things to consider as far as reducing your risk for creating the small particle LDL, which is associated with cardiovascular disease risk. For someone who's adherent to a healthy, low-carb lifestyle, they're typically going to see the large particle size LDL protein, which is associated with none of these aforementioned risk factors, and it does not cause damage to the blood vessel walls. So that's important to understand. I would like to refer you to a video that was very well put together, explaining the science behind all of this much better than I can, and takes a bit more time to do so. Dr. Nadir Ali, and this was at the Low Carb Down Under conference, I think in 2020 or around 2020. So if you wanted to look that up on YouTube, we'll put the link below as well. I appreciate any questions or comments you have. Let me know the suggestions that you have for topics that we cover, and please like, share, and subscribe. Thank you.